So sexual function is a very important factor in men considering prostatectomy. It is a known risk factor for having surgery. And a lot of it depends on several factors. First is the experience of your surgeon. Second is your age. And third is whether a nerve-sparing procedure is performed or not. I'll start with the latter. If your cancer is limited to one side or one lobe of the prostate, your surgeon will generally do what's called a unilateral nerve-sparing prostatectomy. In those cases, they will go wide, taking a wide margin on the side of the prostate where there is cancer in order not to get a positive margin. And on the side where there is no cancer, they will spare the nerves. Sparing the nerves involves cutting into the prostate capsule, what's called the non-Vies fascia, and sweeping the neurovascular bundle off the prostate. The risk of doing this on both sides is that you can leave some cancer cells behind, which defeats the whole purpose of performing the operation. So in most cases, if you have a unilateral cancer, a one-sided cancer, you can undergo a unilateral nerve-sparing prostatectomy. I will quote patients that when a unilateral nerve-sparing prostatectomy is performed, in general, you have a 50% chance of keeping your erections where they are prior to having the surgery. So there's a 50% chance that you will end up with a significant degree of erectile dysfunction. This does not mean you won't be able to have sex in the future, however. There are many different agents out there that can help you perform well sexually, such as Viagra, Cialis, Levitra. Those are the pills that are used. There are vacuum devices that can be used. There is injection therapy of a drug called prostaglandin, which can give you an erection and involves injecting your penis much like a diabetic does with insulin. There is a suppository that can be placed in the urethra that contains prostaglandin, and that is called Muse. The other factors for erectile dysfunction, though, associated with surgery are your age. And it's well known that the older a man is, the greater the risk that he will have erectile dysfunction following a radical prostatectomy. And that's irrespective of the skills of your surgeon. So age is a significant risk factor. A patient's general health and well-being. Obese patients or patients with coronary artery disease or high cholesterol, vascular disease, or diabetes are at a significantly greater risk of developing erectile dysfunction following a radical prostatectomy as well. So it's a confusing topic, but what I tell patients is you should really sit down and discuss this risk with your surgeon, as well as the other risks that are associated with prostatectomy.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.